G'day there, keep smiling. You're on the other side of the, you're on the right side of the hill now, so it only gets better from here every day. Every day gets better. So today, this video is on swelling after joint replacement surgery, which does concern some people. So we've made a video specifically to address this. Swelling around the hip after joint replacement surgery is universal. Very, very common. Everyone will get it to some degree. It'll be variable. So some people are really lucky and they get like hardly any. And then some people get a little bit more. Probably people who get a little bit more swelling are those people who have had posterior approaches. But swelling, regardless of the approach, everyone will get it. Predominantly, the swelling is around the wound itself. There is a section just below the wound where there'll be like a small accumulation, almost like a half egg. It'll be soft and a little bit more swollen in that section. So if you notice like a little half egg just underneath your wound, that's actually pretty common. Don't be concerned about that. The swelling after hip replacement surgery over time, as you start to get up and around and sitting in chairs a bit longer durations and things like that, will go down the limb under gravity. So what you'll tend to find is at the start, the swelling will be prominently around the wound itself. And then as time goes on, the swelling will then start tracking down the thigh a little bit. It'll make a lot of people's knee feel stiff. So they'll have this feeling like their thigh feels a bit tight. Some people get a lot more swelling in their knee. Those people with poor circulation are probably a little bit more predisposed to getting swelling even further down, for instance, into the foot. And so a little bit of puffiness of the foot, if you're one of those people who's a little bit predisposed to that, is pretty common. There will, in some cases, be associated bruising as well. So you get bruising around the wound, but also down the leg a little bit as well. So don't be concerned about that. So swelling is not dangerous, right? So there's not any harm associated with it. If there's a little bit more swelling around the wound, we call that a hematoma. And indeed, that's universal as well. So a hematoma is just really, there's collection of some blood inside the track of the wound itself before the skin edges and the wound edges have had a chance to be able to seal. So you don't need an ultrasound or anything like that to be able to diagnose a hematoma, because everybody will have some degree of blood in the wound residual, right? That accumulates from the freshly surgical wound. So don't be concerned about any degree of swelling in and around the wound itself. What you don't really need is an ultrasound to be able to diagnose it. Is not really going to change our management strategy. Okay, so what's the treatment for swelling after hip joint surgery? So it's all the simple things. Compression pants we found are really useful. So for most people, we would recommend that you use them at least for the first couple of weeks. So generally you want something that will compress all of the regions. So it needs to be able to compress the areas that typically get swollen, which is around the hip, in the thigh and in the knee. So lycra pants that go from hip all the way down to ankle are probably the best ones. And you can get them from a variety of different sources. We sell them here. You can also get them just from an ordinary sports store. They just have to be something that's relatively firm. So we don't want loosely fitting lycra pants. We want them to be difficult to get on. So they need to be firm to be able to provide the compressive effect to be able to reduce the swelling. Okay, the second thing is icing the local region around the wound will help, and you would have had that in hospital. A lot of people would like to continue their icing after surgery, so you can just use an ordinary ice pack, or you can continue to use the Iceman devices like you've used in hospital, and we can rent those out if you prefer that one. But the most important thing for swelling after joint replacement surgery is time. So you just got to be patient and it will go down. So in a lot of people it goes down after just a couple of weeks. Some people who are a little bit more predisposed to swelling takes a little bit longer. But it's not a dangerous condition, just be patient, it will go away. Okay, so there are some warning signs you need to know about. So these are the things that you need to be concerned about. If you have any of these after surgery, you need to let us know. So the first is wound discharge. So if you've got significant wound discharge, then you need to give us a call. If you've got any area of redness around the wound which is spreading, right? So both wound discharge and spreading redness might be signs, for instance, of infection, right? So that's something that you would need to let us know about early. The other thing to let us know about is if you've got significant calf pain, which sometimes can be associated with a deep venous thrombosis. So if you've got any of those, wound discharge, spreading redness or calf pain, then please let us know early. Swelling of the wound itself, or a degree of thigh discomfort or knee swelling or some bruising are completely normal, and you don't have to be too worried about those. Of course, if at any stage, if you have any concerns about any symptoms, let us know, peace of mind, and make an appointment, come in, we can have a look at your leg, and we can make an assessment and give you some advice. But the main take-home message that I'd like you to know is that swelling after joint replacement surgery in and around the wound, down the thigh and into the knee is common, right? And so it's not a dangerous condition, and you just need to treat it predominantly with compression pants, icing and time. Okay, so I'll see you soon at the post-operative appointment, and if you have any concerns, just give us a call. Okay, have a good day. Bye.